Hello everyone, and welcome to Tuesdays with Tina. It is Tuesday, February 20th, and today we're going to be discussing tissue ballooning. I've had requests for this discussion of what does it mean, what is happening when the tissue starts to balloon when we're doing our injections. And so I had maybe 4 or 5 people reach out to me just this week on that one specific topic. So I'm like, well, maybe we need it. So hello, Instagram. Happy to see you there. And hello, Facebook. Happy to see you guys there as well. And for those of you that are new to joining me, again, my name is Tina Clark. I'm a hygienist, been practicing for over 20 years, and I love anesthesia and lots of things clinical. And I just come on Tuesdays and just share some thoughts and insights with you guys. And then it gets recorded and gets put on to the Teacher Tina RDH YouTube channel as well. So as I said, today's topic is all about tissue ballooning, especially when we're giving our injections on the mandible. Like I said, I had several people reach out asking about this particular topic and the reasons why it happens, how to stop it from happening if you can, and reasons of what you do when you do see it. So reasons why it happens. Well, I will say we will often see the tissue expand and balloon out when we're doing mandibular injections, especially like right around the mental foramen. So if we're giving an incisive injection or a mental injection, oftentimes we'll see that particular ballooning happen where you're going in, you're giving the injection, right? And that nice deep V of the vestibule now starts to go and shallow out and balloon up. You might even see a little bit of the cheek kind of puff out a little bit as well, right? I don't know if those are the things that you're seeing, right? You're injecting the solution and it looks like you're filling up a water balloon. Well, the reason why that happens could be a couple of reasons. One is if it's a pretty shallow injection as well, that anesthetic doesn't have a lot of space to go, and so you're going to see it coming up to the surface quite easily. That's going to be one reason. The other is, especially in the mandible, you can't do very deep injections, and there isn't a lot of place for that solution to expand out to. So oftentimes we will see that tissue in the vestibule bubble up to the surface and fill up. So you will see that. What you do when you see that happening is just apply some pressure and allow that anesthetic to kind of soak in, for lack of a better word, soak in to the bony area through there. Now, that is a very common and very benign reason for that tissue ballooning to happen. Now, sometimes you can see that tissue swelling or that ballooning happen with a hematoma, okay? And that can happen on the maxilla, on the mandible, where you're going in and you're injecting. Maybe you nicked a little blood vessel along the way. You may aspirate and still get a negative aspiration and have a hematoma, okay? Because it can happen on the way in or the way out of your needle insertion. So if you see that happening, you're going to see the tissue balloon up and swell, but you also see some coloration happening with it. Now, in those kinds of scenarios, what you'll do is apply some pressure so we can stop the bleeding, maybe even an ice pack, which would be very kind to your patient. Definitely need to inform your patient. Say, don't be surprised, you got a little bit of a bruising happening. It's a common minor complication that happens when we administer anesthesia. Depending upon the patient's health history, if they're on blood thinners, we might see hematomas a lot more often. So that could be just a blanketed conversation that you have with your patients. Start taking aspirins or other types of blood thinners have them be aware of that. Some individuals may decide that they want to do antibiotic therapy for their patient, and that is oftentimes clinician preference, especially if there is active inflammation in the area and then they get a hematoma. Some may choose to do a prophylactic antibiotic prevention for that, just to keep an infection from continuing on. It's I would say that I think we need to be a little more conscientious of our antibiotic prescription writing, that we're doing it for a purpose. I don't know if anybody else agrees. So give me a thumbs up or a yes if you agree that we do need to be a little more conscientious of our antibiotic prescription. So in the case of a hematoma or for just basic tissue distension due to anesthesia, may not necessarily always be the required thing to do, but I can understand why some clinicians would do that, especially for a patient that has active infection happening. If there's an abscess and then the tissue also starts to swell in that area after post-injection, that I could see that happening. All right, friends. So that's just a little review of why the tissue distends. Shallow injections, there's not a lot of room for the anesthetic to go. So you'll see the solution likes to go the path of least resistance. Okay, so you might see that tissue expand out, so that vestibule from being a deep V coming out. We might also see that happen if there's a hematoma as well. So those are some of the two main reasons we'll see that. Applying pressure immediately is great. Very common, especially on the mandible, to see that if you're doing a mental or incisive injection, to see that tissue distension. And remember, the main difference between a mental injection and an incisive injection literally is applying pressure to push that anesthetic into that mental frame, and so you get true pupil anesthesia. So it's very common to see that tissue distend in that zone. So you just apply some pressure, allow that anesthetic to flow in. If it's a hematoma, apply some good pressure, and then maybe even an ice pack for your patient. Okay, friends, I hope that helps. Again, it was a week of that same question from multiple different people. Like I said, like 4 or 5 people had requested that one particular topic of, is this normal? What am I doing wrong? Why is it happening when the tissue starts to balloon up? I actually even wrote a blog about that about a year or two ago, and what I'll do is after this live, I'll put a link into one of the social media threads to that blog, so you can even read up on that as well. All right, friends, thank you. I totally appreciate the request for information. I love it. It really makes my job a lot easier to talk about what you want to hear, because that's why I'm here. I do it from my heart, and I'm here to provide information that seems of value to you. So thank you for the requests. And I want to finish with the quote that I posted this week, which was from the owner and creator of Chick-fil-A. I've been going to Georgia on a regular basis, providing anesthesia certification for the hygienist there. And I actually finally got to do some little sightseeing and went to the original Chick-fil-A. And there was a quote on the wall by the owner that said that success comes and goes, but excellence endures forever. And I think it really spoke to me, because no matter what it is that we're going to do, if we strive for excellence, in my personal opinion, if we strive for excellence, the success will come. And we might have peaks and valleys of that, but you will always know, like, you gave it your best. And if you can put your head down at night, knowing that whatever you had to give, you gave it your all and you gave your best, there's nothing else we can ask for. So thank you, friends, again for the request. This will be recorded. If you want to share it with your friends, you can go to the Teacher Tina RDH YouTube page and subscribe and share it that way. You can always share these posts also with your friends. And yes, thank you again. I will see you guys next week. Cheers. Bye.